Hi everybody, today we're going to be talking a little bit about the nutrition physical focus exam and all of the components that go along with that. We are going to be doing a head-to-toe approach where we look at the hair, skin, and nails for any micronutrient deficiencies, as well as the major locations on the body, like your collarbone, your temporal area, your calves, knees, things like that for macronutrient deficiencies as well. And that's where you'll see any muscle or fat deterioration and muscle and fat wasting. Anytime you come into a room as a dietitian, it's really important that you introduce yourself with your name and your job title. So I would come in, hi, my name is Shelby, and I am a dietitian working with you today. Can you verify your name and birth date for me?
My name is Lori Holt, and my birthday is October 2nd, 1961.
Awesome, Lori. And have you had any unintentional weight loss in the last couple months?
No, I have not.
Nope. Alrighty. And do you feel like you've experienced any poor appetite at all?
No.
No. You'll notice I also had the patient verify their name and their birthday and had a small discussion about their eating habits. This is a great time to kind of see the cognitive side of the patient, looking at if they're alert and oriented, making sure that they are here and can give you permission to complete that nutrition-focused physical exam. Any sign of poor appetite or unintentional weight loss could be another piece in your puzzle to diagnosing malnutrition, as well as your muscle and fat wasting along the body. So we're going to go ahead and get started with the physical assessment. The first thing that we like to look at is going to be the hair, the skin, and the nails. So starting with the skin, we are going to be looking at the temperature, the texture, the hygiene, and the color of the skin. So if the skin is a little bit more pale, that could be a sign of some sort of deficiency. If somebody has a lot of wounds on their body, whether they're pressure wounds or things like that, if they come in that way, that could suggest that they have heightened protein needs. And it's really important to get your patients those protein needs to help with that wound healing. Taking a look at the skin, is the skin dry? If the skin is potentially dry, it could be a deficiency in different fatty acids or even vitamin A. Also looking at the color, so is it pale? Is it warm to the touch? Taking the back of your hand and feeling the skin as well. While you're here with their hand in their arm, you can also take a look at their nails. So taking a look at the different components of these, the shape, the color, and the thickness of the fingernails. So if you press on a healthy nail, it will start out as light pink. When you press, it will turn white and it will return back to that normal color. That is what we would like to see. Also taking a look at the thickness of the nails. If they're brittle or breaking, that could be a micronutrient deficiency, as well as the components on top of the nails. Are they ridged? Are there lines kind of striking across them? Those are all components we look for when we're looking at for micronutrient deficiencies. Next, we're going to take a look at the patient's hair. So this is where we're looking for any color, quantity, and distribution of the hair. Is the hair easily plucked from the head? And different things like that, making sure that this all looks good. And hers does. So we can move on to the physical assessment where we're going to start palpitating the body. So when completing the nutrition physical focused exam today, I am going to be just touching a variety of different locations in your body. We'll be touching your face. We'll be going down your collarbone, your shoulders. We'll be looking at your hands, your calves, your knees, just locations like that. Anytime someone experiences unintentional weight loss, we worry that it is muscle deterioration, and that is not what we like to see. So we're going to complete this exam to make sure that you're not experiencing any of those things.
Okay.
Could you please remove your glasses for me? Perfect. Especially right now, it's always really important as a dietitian to have gloves on. I don't have gloves currently, but make sure that you have gloves on before palpitating a patient. So you're going to start with the head, and you're going to feel right along this temporal region. So palpitating lightly along the sides of their head. You're looking for any hollowing at all. Severe hollowing or scooping could be a sign of moderate to severe malnutrition and muscle wasting. Next, we're going to go ahead and move down and take a look at the collarbone. So looking here, we're going to just palpitate along the collarbone. Her collarbone is not protruding. For a lot of people with severe malnutrition, it will be extremely prominent, and that can show a sign of severe muscle wasting. For some females, it may naturally just be prominent, but you'll really see a severe depression here if it is severe muscle wasting. For most males, you shouldn't see that. If you do, that is a good sign that they have some of that muscle wasting in this location. Next, she kind of has the sweatshirt on, so we're going to go around the outside of the sweatshirt, but you'll be feeling around the shoulder here. So a healthy shoulder is going to be curved like hers is, but if it was more square and the bones protruding out the back here, that's kind of where you would see that severe muscle wasting as well. I'm going to have you hold up your hands and make the OK sign for me, please. Perfect. There's a nice little muscle in here that we're going to be feeling around for a little bit. So really we're looking for that muscle to be thick with no bones sticking out. If there are bones sticking out on this back side, that would be a sign of severe muscle wasting there as well. We're going to move our way down the leg. I'm going to have you bend your knee if you could. It's always important to ask a patient if they're in pain anywhere when you do this. A lot of times patients may have sore legs or something going on, so it's really important to check in with the patient before you do something like this. If they do have a side maybe that's not in pain, moving to the other side of the bed and doing the exam that way. So next I'm just going to be feeling your calf. When you're feeling for the calf, you're feeling for a circular muscle that's really attached to this bone here at the top that's rounded. If a patient sits their knee up here and the calf basically drops down and you can see that prominent bone, that's a sign of severe muscle wasting. So this calf looks really good. I'm also going to take a look at the knee here, or the patella. So her knee is very rounded, which shows nice muscle definition here, which is great. Somebody with severe muscle wasting would have a very square knee with the bones protruding from there. So that's what we would look at. When looking at the fat, you can go ahead and straighten your leg out for me. When looking at the fat wasting, we're first going to take a look at the fat pads under the eyes. So I'm going to be touching her face here as well. If you could just look up, I'm going to lightly touch underneath her eyes. You should see some depression a little bit. There should be some fat pads there. For somebody that has severe hollowing or really large scooping under their eyes, that is a sign of severe fat wasting. I'm also going to have you raise your arm up and bend your arm at a 90-degree angle. Perfect. Now we're going to be grabbing underneath the arm here and rolling our fingers down. She has a nice tricep here, and basically at the bottom you're just going to kind of give a good pinch. And if your fingers don't touch, that's a great sign. If they do touch, that is a sign of severe fat loss. So looking there for the severe fat loss as well. Okay. Alrighty. It's really important during a nutrition physical focus exam to write down any abnormalities that you see to potentially diagnose the patient with malnutrition. So they could be mild to moderate or severe, but if you do notice a portion of the body that is kind of at risk for one of those things that we discussed, it's really important to make note of those to eventually come back to for that diagnosis. Another thing to look at is the edema. So the edema in the body basically is just that fluid accumulation. A lot of patients may have this in different spaces in their body, but it is pretty common around the feet and ankles. So you can take a look at the feet and ankles. This can be something that you do as a dietitian, or it could also be found in the nurse's charting notes. They may have done that as well. There is such thing as pitting edema. So if you are able to touch and palpitate the ankle, and the palpitation stays and doesn't kind of bounce back, that is a sign of pitting edema, and is something to kind of take note of as well. So you'll just look through the body for different locations with the edema, or take a look at those nurses' notes and that charting to take a look at the edema as well. All of these are going to be key components when diagnosing malnutrition and doing a nutrition-focused physical exam. It's always so important to make sure the patient is comfortable and relaxed while you do this. You can always ask questions such as, what do you typically eat in a day? Or have you noticed any changes in your body, to kind of make the conversation more comfortable while you're touching around the patient, because sometimes that can be a little bit uncomfortable for some people. That is, in a sense, the nutrition-focused physical exam conducted on one of my wonderful patients. So thank you for being my patient.
Thank you.
Mm-hmm.